Apparently, in states that have gone ahead and opened up the state medical exchanges and expanded Medicaid under the provisions of Obamacare, going to jail ain't so bad if you need health care. Tarren Bragdon is the CEO of the Foundation for Government Accountability. They are a great group with regard to analyzing exactly what's wrong with health care in America, specifically the effects of Obamacare, and he joins us now. I read with great interest this report that your organization delivered. It was written up in the Washington Times, and apparently inmates are getting some pretty great tax-funded, federally tax-funded health care that they didn't used to get. What is this all about?
Well, it's great to be with you. Here's the facts, and that most people don't realize. Under Obamacare's Medicaid expansion, about 1 out of 3 of the new people who qualify for Medicaid, according to Obama's own Department of Justice, are former prisoners. And so what we're doing is, under Medicaid expansion, we're rolling out the red carpet for prisoners while we're pushing other folks aside.
So let's explain that. And this is critically important because we've got one state here in our radio frequency here, Maryland, who wholeheartedly embraced the state exchanges, and Virginia, who up until now has resisted it. If the governor has his way, McAuliffe, they would jump on board too. So tell me, what is the difference with regard to how prisoners are treated in the two states and where that money's coming from?
Well, in Maryland, what happens is, for all the new people who have signed up for Medicaid expansion in Maryland, about 1 out of 3 of them are people who are exiting prison. In fact, they have Medicaid enrollment seminars while the folks are still in prison to make sure that they're signing up.
Wow. They actually line them up while they're in jail and say, here's how you get your Obamacare the second you get out.
Exactly. And even some services are now covered even while the prisoners are in prison. Some when they have to go to the hospital for extended periods of time.
All right, so look, our tax dollars at work. How many of them are being used for this?
Well, let's put it in perspective in Virginia. So Virginia, there's talking about reaching 400,000 people with Medicaid expansion. That means about 150,000 of them are individuals who are former prisoners.
And I think that people who were in favor of the expansion of Medicaid under Obamacare thought, well, we're giving this to women and children who are, they don't make enough money, they're not working, they don't have health care through their employer, and out of the goodness of their hearts, they wanted to help those people. But you're telling me that because this money is going to these people as they're getting out of jail, that means other people who didn't break the law are getting left behind?
Exactly. And it's even worse than that, because Obama's Medicaid expansion is paid for by $716 billion of cuts to Medicare. So what we're doing is we're rolling out the red carpet for prisoners, and we're paying for it by taking money out of your mother and grandmother's Medicare benefits.
I think this is one of those things that just drives people crazy. What is the motivation nowadays for people to go out and be productive and to have a job and to try to do the right thing, and go out and be somebody in today's world when you can choose to do none of that and just have the world handed to you on a plate?
Well, I think that's a great point, because for individuals who are receiving this new benefit, including all these former prisoners, if they were just working full-time at a minimum wage job, they wouldn't qualify. So what we're doing is we're rewarding people and trapping them in poverty through this Medicaid expansion, rather than promoting them to work hard and better themselves and realize the American dream.
Now, I saw your report. Again, your organization is called Foundation for Government Accountability, and I saw this report. It feels like it was about a month or 2 months ago, and the way I saw it was I saw fact-checking groups and progressive groups, people who were in favor of Obamacare, debunking it and saying this wasn't true and you were misrepresenting the case. But is it true that the Government Accountability Office, they've actually done an independent study of 6 states and have confirmed your report?
Absolutely. I mean, this is where the people don't like the facts, but it doesn't mean that they're any less true. You have the U.S. Department of Justice, who came out with this estimate of 1 out of 3 of folks with Medicaid expansion being former prisoners. And then you have the GAO, as you just mentioned, do an in-depth report in 6 states looking at this phenomenon. So this isn't something that's coming from, folks on the right. This is things that are coming directly from the federal government.
So the state they looked at California, Colorado, New York, and Washington. They're all on board with expanding the state-run healthcare system, just like Medicare here, and just like Maryland here. And then they also looked at North Carolina and Pennsylvania. So what is the difference between those states?
Well, what you had is in states that expanded Medicaid, you had almost all the prisoners qualify for Medicaid.
Does this include, I'm sorry for interrupting you, does that include, I know in California a huge part of the population in prison are people who are here illegally. Are they also getting this?
No. If somebody was here illegally, you have to be a citizen to qualify for Medicaid, so those individuals are not included.
Okay.
All right. So, I mean, if you are as outraged as I am, I guess the question is there anything we can do to reverse this?
Well, I think what you want to do is do exactly what the Republicans in Virginia are doing, which is reject Medicaid expansion. Because what you're saying by accepting it, you're saying that I'm prioritizing former prisoners over my sick elderly folks receiving Medicare, and I'm also prioritizing them over other state priorities, cops, kids, roads, schools. This is exactly what happened. If you give to this new group of individuals, you take away from other folks who I think are more deserving of state funding.
There isn't unlimited money? This is a new concept. Let me just ask you, let me be devil's advocate on this. I mean, there will be people out there who say, well, listen, this person may have committed a crime, but they've served their time. Now they're coming out into society. Why should we have them exposed to, injury or illness or something? We have a bleeding heart and we need to help these people, even if they've committed a crime. Is there anything wrong with that?
No, I just think that, as you mentioned, there's not unlimited money. And what we need to do is keep the promise to the most vulnerable before we start making new promises to individuals who have never received any other welfare benefit before.
Well, I'm sorry for interrupting you. We do have to roll, but as this debate is beginning to rage in the Commonwealth of Virginia, and Terry McAuliffe, the new governor, has said that expanding Medicaid in Virginia is his top priority. This is certainly something that people need to be thinking about. I so appreciate you being here, Tarren Bragdon.